When you're doing direct immunofluorescence studies, here's a few very important things to know. If you are biopsying looking for an autoimmune blistering disorder such as pemphigus vulgaris, pemphigus foliaceus, bullous pemphigoid, or dermatitis herpetiformis, you want to make sure you biopsy at least 3 millimeters away from an active lesion. So you're biopsying normal skin here because that's where you're going to see those pathogenic antibodies being deposited in the skin that are causing the blisters in these diseases. If you're biopsying something like vasculitis, you're going to want to actually biopsy on the lesion of vasculitis, and it's very important that you get a lesion that is between or is less than 72 hours old, because you don't want something that's been around for too long. You could potentially lose those pathogenic antibodies in that case. If you are biopsying something like lupus, what you're going to want to do is also biopsy on the lesion itself, but you're going to want to get that active red edge of the lesion, and that's going to make sure you get the most accurate result in that case. When you're talking about direct immunofluorescence studies in general, it's also very important that you have the correct media in your office. It's called Michel's media. Some people call it Zeus media, and it is different than formalin. If you put that tissue for direct immunofluorescence studies in formalin, you run the risk of degrading the antibodies. Now, it has happened that we've accidentally put it in, and sometimes that can be okay if you take it out right away and put it back in your Michel's media, but really nice to have that media on hand in the office just in case you need to do one of these studies.